The talk that I gave earlier this morning covered the 8-year period between 2006 and 2013 and basically asked what kind of progress had we made and how many miles do we have to go. Linkage to care rose to 76% during this period, and viral suppression within 12 months rose to almost 70%. Age and CD4 at diagnosis, CD4 according to treatment at interval signifying treatment eligibility, were the strongest predictors of failure to link and also of failure to suppress. The young and healthy don't do as well with linkage to care or viral suppression, and it should actually be said young or healthy, because whatever your age, if your CD4 is over 500, you are at risk of failing to suppress your virus. People at this conference aren't talking about the perfect Greenwich scenario of eliminating HIV in 30 years with 100% diagnosed, 100% treated, and 100% suppressed. But they were talking about 90, 90, and 90, and getting really close to it in Australia. So we asked ourselves, goodness, could we achieve that in New York City, starting off at 70%? We're close to 90, 90, 90. Actually, we're way beyond it with pregnant women in New York since about 1997. This took science, law, a prodigious effort on the part of the New York State Health Department, vast changes in practice, and buy-in by doctors and women in the community. We won't do this with adults, but can we do better? Can we get to 90, 80, and 80? 80 and 80 would mean that we just have to increase our linkage to care, or our ART and our viral suppression by 10 percentage points. And we are already at about 86% diagnosed, so a small increment in that might make a big difference. We're quite close to that on diagnosed now, but we'd like to raise the bar on care and viral suppression. Today's focus was on positives, but we can't forget that the whole public health package includes getting PrEP and other effective prevention strategies to the people that need them the most, so that we provide both for the positives and the negatives that are at risk of seroconversion. And another extremely important thing from our point of view is finding a method whereby we can diagnose acute HIV infection early enough so that we can, when the viral load is highest and transmission is most efficient, so that we can intervene at that time, get people on treatment, and prevent these very rapidly growing clusters and chains of transmission that take place at that time.
What's the comparison between, what's the situation throughout the United States compared to what New York has found?
We have a bit of an advantage over the national data. We're clearly not doing as well as they do in San Francisco, and you may have heard that presentation yesterday. But we are right at the same level as the national undiagnosed rate. So they are projecting, CDC's projecting 14% or estimating 14%, and we are at that right now by the results of our last sero survey. I think we have seen a very steep rise in viral suppression that is coterminous with changes in practice and possibly also with changes in guidelines. We have not seen as steep a rise in linkage to care. That has been a bit more modest. And other jurisdictions like San Francisco also have a good surveillance system and are also following this. But we have the advantage of having longer term laboratory reporting data, and many of the big states with the big epidemic have just begun their laboratory reporting.